Okay, let's go ahead and get started because I want to make sure we give plenty of time for today's presentation. So thank you all again for joining us today. Today we are going to be presenting on putting fertile back in infertility with our guest, Dr. Julie Cecere, who you're so excited to welcome back. Dr. Cecere is going to be covering the commonly touted causes of infertility in brood females, and we'll be discussing the importance of checking both the male and the female prior to breeding, nutrition, and fitness. And then we're also going to touch on the causes of infertility that are outside of a breeder's control, like endocrine diseases, genetics, shipping semen mishaps, and frozen semen disasters, which sounds like it would be the name of a great TV show, as well as the current research and treatment recommendations. We are so excited to partner again with Purina to bring you this webinar, and we're really excited to bring a brand new topic to our community that we have not covered before. So as always, please continue writing into breederteam@gooddog.com and letting us know what more you want to see from these webinars. We are planning them throughout the rest of this year, and we are so excited about that. So we want to make sure that these are serving our community in the best way possible. So please just continue sharing your suggestions with us, letting us know what you want to see us cover next, because it's so helpful to hear. And like always, we're going to have a Q&A at the end of this presentation, and we're going to prioritize those previously submitted questions from our community first. But of course, if you want to ask any, we'll try to do our best to answer those as well, and you can do so using the Facebook chat, and we'll do our best to get to those. And I just want to quickly talk a little bit more about Dr. Cecere, who's joining us today, and her amazing background in canine health before I pass things over to her. Dr. Cecere completed her veterinary education at the Virginia Maryland College of Veterinary Medicine. She worked in private veterinary practice and commercial settings before returning for a residency in animal reproduction. Dr. Cecere is a diplomat of the American College of Theriogenology, an organization to which she has contributed in several leadership and service roles. She is clinical associate professor of theriogenology at the Virginia Maryland College of Veterinary Medicine, where she has developed an internationally recognized clinic for canine reproduction. Dr. Cecere lives in Virginia with her family on a small hobby farm and enjoys upland dog hunting with her children and riding horses in her spare time. I know we have a lot of horse breeders in this community as well as dog breeders. So with that, Dr. Cecere, I'll pass things over to you to get our presentation started.
Thanks, Nicole. I appreciate it. It is definitely here in Virginia starting to feel a little bit like fall. Usually this happens, we get a little bit of a tease and then we get a heat wave, but it reminds us that fall is coming. So definitely have had the windows open at night and sleeping better in the, the cool of the evenings. When I was asked to do this topic, this is a very large could be a very large multi-lecture kind of topic because there are a lot of things that are out there and there's even more breeder lore that's out there. And so this is going to be kind of like a broad brushstrokes over some of major things. And so I try to hit the major causes and not do what we call in veterinary medicine chasing rainbow colored zebras. Because certainly if we rule out the top 3 or 4 causes that we're going to talk about today, then we really need to be referring these cases to a diplomate of either ECAR or a DACT, because there's going to be something very unusual, and the likelihood of you coming back from the brink with that individual animal is pretty low at that point. But hopefully this will be helpful for you guys to kind of just go through what the top causes are, how do we diagnose them, and then where do we go from there. And so by and far, timing is going to be the number one. The number one animal that we get sent to us for quote unquote infertility is poor timing. And so we're going to talk about that. I'm going to touch on it. I know that I've done some lectures on doing artificial insemination and the timing associated with that, but it never hurts to hear it multiple times and in multiple different ways. The other thing is which part of the 50% of the equation are you dealing with? So do you have the male side or do you have the female side? Because despite what everybody wants to think or who wants to point fingers or who wants to blame who, it takes both to be fertile and both to be put in at the right time for them to affect a litter. And so again, we'll talk a little bit about the male and the female side again. Endometritis is a term that we use a lot in horses. It is something that we recognize readily in horses. It's where a lot of research has happened. We do know it happens in dogs, but because of the way that they cycle and the way that we have to do things these days, because they are a companion animal, research is really lacking. But we're going to talk about cases in which we think, and how do we determine whether or not we think endometritis is happening, and how do we treat those animals, or at least diagnose it so that they can be appropriately treated. This is not a, pick up every antibiotic known to man and throw it at the female and hope something sticks, because that's got its own set of problems with it. Genetics is also going to be a big factor. So we're going to spend a few slides talking about that, because I think it's something that people don't talk about enough, especially when we're talking about our purebred dogs. When we are doing a lot of breeding to keep that phenotype that we like, we actually may be doing more detrimental to our breeds than beneficial. And so we're going to talk about that a little bit. And then we're going to kind of cap everything off with endocrine, because a lot of people like to blame things that have been tried and true and proven not to be a factor, really. And so we're gonna talk about that lastly, and then we'll try to tie everything up with a nice little bow at the end. So worst case scenario for a breeder is you've gone through everything, you've bred these animals, and then you go in for your pregnancy diagnosis, at 21 to 30 days, and she's open. Or worse, she has what's represented here are resorption sites. And there are three real major reasons that we're going to be open. Poor timing. And so generally that's the first thing that we check. Even if we bred the dog, we go back, we pull up the progesterone profile, we pull up the semen evaluation, and we're going to evaluate what's there. And we're like, oh, right, remember this was frozen semen, and the frozen semen post-thaw was terrible, and we're not as surprised that she's open. And so again, versus the other scenario, which would be this is a young fertile female, it was a young fertile proven male, timing was spot on, why are we open? And so timing is always going to be something that comes to mind. And then again, undocumented subfertility or infertility. 50% of the equation is male and 50% of the equation is female. And I really don't, I'm trying to make sure that people aren't pointing fingers. Females always want to blame the males, males always want to blame the females. Well, it could be the combination of the two, but if we're not checking our boxes as far as having progesterone timing to prove that timing was an issue, that we actually confirmed ovulation, we didn't just stop at a 5, that the male had a semen evaluation at the time of collection or at the time of breeding, and something hasn't changed, they both have to do their jobs for us to have a litter. And so if I had a dime for every time somebody said, well, he produced puppies 3 months ago, well, the semen that produced those puppies 3 months ago was made 5 to 6 months ago. There's a lot that can change in a male's life in 5 to 6 months. Same thing with a female. If she had a litter and then was given 2 or 3 cycles off, a lot happens in that uterus during that time frame that can contribute to infertility. And so again, making sure that we're crossing our T's and dotting our I's, and making sure that we're doing the best to try to determine what has happened and how we're going to change things moving forward. And then the last one is she did conceive, but then she lost the pregnancy. And this is prior to day 30. So if nobody's getting ultrasounds done prior to day 30, we're probably missing some of these girls, because you would never know that she was pregnant unless you had an ultrasound, because they will grow these embryos and then somehow they will lose these embryos. They will be completely resorbed. They're not aborted. You never see any vaginal discharge. And so again, we really need to document whether she was pregnant and she lost the pregnancy, or she never got pregnant from the get-go. And usually we tell people between day 21 and 28, you really need to be documenting pregnancy through an ultrasound. The other methods are not extremely helpful, especially if we have any question behind whether subfertility or infertility has happened. So the first thing we're going to go through is timing. And I've used this in a couple of my other lectures before, but I think it's a really good depiction. Things that we need to realize with timing is that bitches ovulate oocytes or eggs that cannot be fertilized until they go through a maturation process. And that means this is different than every other animal on the planet. And so what happens is those oocytes have to go through these other divisions that have to happen. And so while semen may be put in really, really early, they can't fertilize those oocytes until they're ready. But there's also a time frame in which is going to be optimal, because canine semen can last in the female's tract, not sitting on the counter, but in the female's tract for up to 7 to 10 days. So breeding on the early with multiple breedings throughout the fertile window is obviously going to be your best bet if at all possible. And so again, it's going to take 24 to 48 hours for them to complete ovulation. It's going to take another 24 to 48 hours for them to complete that oocyte maturation. And then fertilization is going to take 2 to 3 days. But realizing if you're waiting until the very end of that fertile window, you're missing a large portion of your bell-shaped curve of those available oocytes before they actually expire. And the oocytes really don't last super long. And so once they've gotten to those secondary oocyte time frame, they're going to start dying off. And if you don't have semen in there to catch those, you lost that opportunity. So again, breeding on the early and not waiting till breeding on the late is going to be very helpful. And you got to remember the cervix, once we have that diastral shift where we no longer are under the influence of estrogen, we're fully under the influence of the corpus luteum on the ovary, that cervix closes and nothing's getting in there 1 to 2 days afterwards. So again, breeding on the early, planning for multiple breedings, and making sure that that's done with progesterone or LH timing to make sure that you're getting semen in there at the proper time frame is going to be extremely helpful. And for some stud owners, they actually put it in their contract that the dogs have to be timed, or the bitches have to be timed, so that they don't get caught with that. And so talking about breeding management, again, I'm not going to go through the whole thing, but just to have this here. So progesterone testing, and this is progesterone, this is not LH. Progesterone testing on day 5 to 7 of your cycle, this is going to get 80 to 90% of your dogs. Some will ovulate early and some will ovulate very, very late. But if you start around day 5 to 7, you should be good. Reminder, cytology does not tell us ovulation. It only tells us inflammation and if we're under the influence of estrogen. So again, please do not try to use cytology to time your breedings because you are not going to get what you need out of that. Vaginoscopy, where we actually go in and we look at what the vaginal vault looks like, that again is looking at influence of estrogen. It is not a singular thing that you can do. It will assist if necessary. And then we've got to breed based on what we have available to us. If they're the same zip code and they breed naturally and you can do it, every other day, as long as she's standing, is going to give you your highest pregnancy rates and your largest litters. The more numbers you put up there in a natural fashion, the better off you're going to be. Now, the next step down is going to be side-by-side AI. Same type of thing. The more numbers and the more you can put up there over many days, the better off you're going to be. Ship chilled, now that's a little bit different because now we're talking about an added cost, an added time frame around that. And so again, error on the early and not on the late. And remember, semen's going to last 5 to 7 days, sometimes up to 10 days. Once you have semen in there and it's sitting and waiting, it can hang for a little while and then you can reinforce on the back end. Don't wait for the very end of that cycle because you may miss her. And the biggest thing about that is that, again, oocyte maturation is going to be linked to how fast that progesterone rises. And if they rise fast, then you may miss them if you're waiting too late. Okay. And then lastly, frozen. Frozen is the only time frame in which we need to catch them on the most fertile days. And that's going to be day 3 to 4 post-ovulation via progesterone testing. And the reason that we have to do this on the late is because the semen will die after thawing in 12 to 24 hours. So I don't get that 5 to 7 or 10-day time frame that I get with side-by-side fresh or chilled semen. I get 12 to 24 hours. And so we've really got to time that to be really, really, really tight. So making sure that when you're using frozen, that we have that plan in place and we understand that there's always a risk. And the bottom line is one of the things that a lot of us forget about in planning a breeding is what days we can ship or receive packages. We don't want semen sitting in a box for more than 24 hours. And so, no, I can't collect a dog on Saturday for an insemination on Monday. And no, I can't collect a dog on Sunday for an insemination on Monday. That semen's minimally going to be in the package for at least 48 to 72 hours. And at the way some of our shipping companies are going these days, it may be 2 to 3 days before it gets there sometimes. And at that point, that product is no longer viable. So again, just plan ahead and think of those things for breeding management. When we kind of tie it all together for the timing, these are kind of the rules you need to live by. Natural cover with a fertile male, multiple times during that fertile period, it's going to result in the highest pregnancy rates and litter sizes. The more semen you put in the female, the better off you're going to be. So if you have a male and you have two people that want to breed to that male, you need to be very careful and have very good communication that we are trying to breed two females at once. You cannot split collections. You can't take a collection like we can from a stallion and put it in different females. You won't have enough. You need to put one collection in one female, give him a day or two off, and then another collection in another female. This is very important. And we do have missed pregnancies for low numbers. And then frozen requires careful timing, and it's always a gamble. You can think the stars aligned and you will still end up with an open female. So again, it's always a gamble. It's never a guarantee, and it is never convenient. So don't let anybody ever tell you that frozen semen is convenient, because it's not. Okay, so that's timing kind of in a nutshell. The next thing we're going to do is talking about the 250% of the equation, right? One side and then the other side. So unfortunately, I would say people like to point fingers at the dog when it's not always the dog that's the problem, but the dog is the easiest way for us to actually be able to rule him in or rule him out as a potential problem. And so in addition to just a general physical examination and get good historical questions to find out any history of infertility, any history of illness in the last 4 months, that significant caused fever, or that they were not feeling well for multiple days in a row. And then we're going to do our collection to look at the libido, to look at any lesions that may be on the penis that could be contributing to, say, hemospermia, which is blood in the collection. And then we're also going to be feeling and or ultrasounding his testes and prostate, just to make sure that there's nothing glaring that's there, that we as veterinarians are going to realize that this may be contributing to a problem, or may be a potential problem if a breeding is up and coming. One of the biggest things for breeders is that making sure whenever you have anyone do a semen evaluation on your animal, that you have these minimal things reported every single time. Because not having all of these parts is going to make it really difficult sometimes to be able to figure out where the problem lies. And so you can get color, clarity, motility, progressive motility, and concentration. But if you don't have a morphology, and this dog happens to have a morphologic defect that is going to affect the fertilizing capacity of that sperm cell, you paid for an evaluation that didn't give you the information you needed. So you need to make sure that all of these things, especially morphology, that's why I've got those asterisks on there, have been included, because I need all of these to comment on the numbers of doses and whether or not this is going to be something that we would even attempt to freeze in the future. So again, color, clarity, motility, and if you get progressive motility, great. Morphology is extremely important, and then concentration. If I don't know how many sperm cells are in that sample and given a number per mil, then I can't tell you how many doses you have. Putting a number that says, oh, adequate concentration, there's no standardization for adequate. I need to know actually what the numbers are. So again, making sure that all of this is in there is going to be really important. And so talking about these things, we're going to go through some pictures and some other tests that may happen. And so the morphology, the concentration, the motility, I think most people know about that. There are some ancillary tests that we as specialists may run on some sperm cells, called viability. So why the sperm cells look like they're moving, but there's some that aren't moving. I need to know how many of those are actually moving well, but likely not to make it to the oocyte before they die. And a viability test is going to be able to tell me the percentage of those cells that actually have permeable membranes in their head, and they're likely not to survive until they actually get to oocyte to fertilize it. The other thing is a hypoosmotic swelling test, or a host test. Some people may have actually heard of that. And then a lot of people, I think, are pretty familiar with CASAs now. They're computer-assisted sperm analysis machines. The one thing about those, again, some people think that they're the end-all be-all. They are great because it's AI technology and they're really good at tracking motility. And for us as reproductive specialists, I can tell about how vigorous those flagella are beating. Are they having smaller waves in amplitude or larger waves in amplitude? There are a lot of things that I can get out of that AI technology. But one thing that CASAs are not good at doing is morphology. So morphology always needs to be done grossly by the person evaluating. It needs to be done with a live dead stain or under phase contrast. So that we get the best thing possible so that you guys can actually get more information so that you as the stud dog owner can say, my dog has had a recent, here are all of his evaluations, and or, hey, we had a problem, this female's open, go back, do your BSE and see if there was something there that just wasn't caught. So again, there's a lot of things that we can and can't do, but morphology by far is the one that is probably the most missed. So here on the slide, I've got pictures of multiple collections that we either have done ourselves or we have received. Normal being on the far right. And so again, we've got 3 tubes here representing the 3 fractions. This first one here has a little bit of a yellow tinge to it because there was a little bit of urine in it. Not that big of a deal, but something to note. Second fraction is going to be our sperm rich, which is going to be cloudy. And then pure third fraction should have this clear color to it. I should be able to hold it up to a piece of paper and read through it. That's how clear it should be. This is a normal dog. These other dogs that are on the left and the middle all have blood contamination. And so while blood contamination in itself for a side-by-side or a natural breeding is not generally a big deal as long as it's under 20% of the total collection, this is going to be a problem for shipping, and we definitely cannot use this for frozen. And then the third type is if we actually have purulent debris. So we have an infection going on somewhere and we get this dirty kind of brown colored collection. And that obviously is something that we should be very concerned about. That dog out as far as being collected and used for breeding until we get this cleared up and figured out what's going on with the animal. And just so that you guys can kind of see a little bit, so on the left is going to be a motility, and you guys can look at these little guys moving around everywhere. And on the right, we have one of those CASA machines. And basically, it's just a microscope. We dilute it to a known concentration, put it in a specialized chamber. There's a camera attached to the microscope that goes to the software. And the software looks at those sperm cells and determines how many of them are moving in a fairly straight line. And again, all those extra parameters, which are really good for research, but the extra parameters aren't really that helpful, at least based on scientific research right now. They're not that helpful for us in just pure fertility of the animal. So again, if you don't have a CASA, it's fine. In the studies that we have done, most people who are trained to do motility evaluations are usually within 10% of the CASA machine. So why AI we think is better, it's not always better. We're usually within that standard deviation that's acceptable. And then just to kind of drive this point home, morphologic defects. These are 6 slides of multiple sperm cells that have morphologic defects. Not a single one of these is normal. And so certainly looking at this, we need to know what's going on. Acrosomal defects that are in the top left, there's just this little halo that is here. That's not supposed to happen until it goes into the uterine tube where the oocytes are ready to be fertilized. Once this happens, this acrosomal reaction happens and the acrosome comes off, that sperm cells has a finite lifespan of being able to fertilize an oocyte. So again, if we're seeing a lot of those, that's an issue. In the bottom left, we've got a tightly coiled tail. That sperm cell is going to be immotile. If you have 100% immotile sperm cells, you're certainly not going to affect a litter. Same thing with the middle top. We have what's considered a reflex mid-piece here. This thing's just going to spin in circles. That flagella will beat just fine, but the sperm cell is not going to be motile because it's not going in a straight direction. It can't swim anywhere except for in its small little circle. Below it, we have a reflex mid-piece and a distal droplet. Again, these are not normal. And then on the far side, we have 2 representations of proximal droplets. And these are known in multiple species to prevent fertilization at any stage in the oocyte. So again, a lot of the dogs that are referred to us for infertility, a lot of like, oh, he's 90% modal, he's doing really, really great. And we ask about a morphology. He's never had a morphology done. He comes to us, we collect him, we do a motility, and we do our morphology, and the dog's got almost 100% proximal droplets, and they have their answer at that point. So again, morphology is really, really important and something that we need to make sure we're keeping up with. So when we're talking about, maximizing my dog's fertility, what can we do? Well, select for good fertility. And I don't mean that to be tongue in cheek, but don't keep animals that are having subfertility or infertility problems when they're 3 or 4 years old. I want these dogs to maintain their fertility until they're almost in double digits. That would be ideal, right? But if you choose to keep a line that at one point one dog is 100% proximal droplets and or what we consider completely sterile, he's azoospermic, he's not producing any sperm cells by the time he's 8, maybe keeping his sons may not be a great idea, because what happens is you're going to start seeing that back up to a point where they're never going to produce normal sperm cells. So select for good fertility. BSEs often. If you own a stud dog, keep track of day-to-day changes once a month. And this is really true for older stud dogs. So once you hit 5, we really should be keeping a close eye on these guys, again, because we want to keep track of that good fertility. And knowing that testicular degeneration is an age-related process, we'll start seeing signs histologically around 4 years of age, and then it's going to progress the longer that they live. But that goes back to this peak fertility. Peak fecundity, we're going to produce the best sperm cells with the highest numbers between the ages of 2 and 5. This is tried and true in multiple species, different sizes. And then realizing freezing needs to happen at this age. So if you're going to purchase frozen semen, knowing what age this dog was frozen at, I very rarely see dogs over the age of 8 that were ever able to be put in the tank. Okay, so again, those are the types of questions you need to ask about. A quality diet. Making sure that it's balanced. Certainly we worry about foodborne illness affecting the quality of sperm cells if they happen to contract salmonellosis or campylobacter if they're feeding a raw diet. So again, making sure that that's very important. And then excess heat to the scrotum or ambient temperature. So those of you who are in the show ring with a coated breed and you're using hair dryers to blow dry your dogs after you bathe them in the grooming process, use forced air or cold air when you're around the scrotum and in the back end of the dog, because that alone can heat up the testes to the point where they will actually start producing abnormal sperm cells. And we see it a lot with tightly coiled tails and reflex mid pieces. And this is something that we know from bulls. Excess heat to the scrotum is going to increase the temperature in the testis, and they're going to produce abnormal sperm cells. And so making sure that we're real careful with that. And then everybody always wants to put a dog on supplementation. Not a bad thing, but you need to know what's in that supplement. Glucosamine is never going to hurt anything. We certainly have a couple of studies that are out there that makes a difference on semen quality if they were on a prescription diet that contain therapeutic levels of glucosamine. Okay. The thing is if you actually read a lot of these supplements that people have out there, you need to know what's in there, because cottonseed meal is almost in all of these supplements. And we know in bulls and some other species that actually is a teratogen to sperm cells. It causes abnormalities in sperm cells. So again, be very careful what you're feeding. Most of the time, if they're on a quality balanced diet, then you shouldn't have a problem. And then of course, all these other things that have been studied out there, polyunsaturated fatty acids certainly are never gonna hurt. Think kind of fish oils, zinc, selenium, vitamin E, and vitamin B9, which is folic acid. That being said, the problem is we can't just go to the grocery store and buy all of these things and throw them in their diet. We need to make sure that we're working with a veterinary nutritionist, and 9 times out of 10, you really don't need any of this. Put them on a balanced diet. If you want to put them on a joint supplement, great. Make sure it's a veterinary labeled joint supplement. Human supplements and dog supplements are not the same. And then, have a conversation with your vet. Hey, I'm looking at getting this supplement. Do you think that I need to pass and go to another supplement? My rule of thumb is fish oil, glucosamine is perfectly fine. Stay away from the rest unless we have a conversation. And then breeding doses. your dog may be fertile, but if we're not getting enough semen in there as far as numbers, you're not going to affect a litter, or you're going to have small litters. So maximizing doses of total normal cells that are there means you have to have an evaluation of every sample. The only time that this might not be 100% accurate is, let's say that I'm doing a breeding here, I'm collecting a dog 3 times in 1 week. I'm going to do an evaluation that very first day. The second and third day, I'll probably at least do a motility and a concentration against the know how many numbers I'm putting in there, but I may not do a morphology every single time. Okay. Ideally, yes, we would, but in the matter of time, we may not do a morphology. The breeding dose calculations are based on the size of the animal. And I want you guys to look at this. Toy and small breeds are 100 to 150 million total normal motile for them to be considered one dose. Okay. Medium to large breed dogs, 200 million total normal motile is the minimum dose that we would use. Okay. And based on the weight of the animal, we know how much those dogs should be producing based on their weight. So it's about 10 million sperm cells per kilogram of body weight, or at least 300 million to be considered normal. Why do I say more is always better? Well, the joke is it only takes one to fertilize. That's incorrect. It's the collection of the sperm cells surrounding the oocyte that actually cause enough of a reaction to allow the one to penetrate. So only one is going to contribute its DNA, but I need the rest of them to be able to surround that oocyte and cause the reaction. And then lastly, talking about viability, just because I've got 800 million sperm cells up there and 80% of those are motile, if they're not viable or they weren't actually going to make it there, then those are two very different things. They might die in the uterus before they even have a chance to get where the oocytes are. So that's super important. That's the male side. Let's talk about the female side. So is it pregnancy loss or is it female infertility? And this is where records are going to be really important, making sure that we have progesterone timing or LH timing. And we're talking about historical things in the event that we come up with something short, okay? So inappropriate cycling, the IEI, which is the interestrus interval, that means the time from one estrus cycle to the next estrus cycle. So she's in heat here, and then she's in heat here again. It's going to be a minimum of 4 months, maximum of 12 months. They should be cycling between 4 and 12 months on a regular basis. If they're irregular, they're less than 4 months, or they're greater than 12 months, that's something that should be a red flag and automatically warrants an examination by a reproductive specialist. The other thing is early pregnancy loss. Again, I kind of harped on this earlier, but I'm going to harp on it again. If we are not having an ultrasound done prior to day 30, she may have gotten pregnant, which means the boy did his job, but she lost the pregnancy. And if we're not documenting that, it's really hard for us to understand what's going on. Definition of insanity is to keep doing the same thing over and over again and expecting different results. So again, making sure that we're doing those ultrasounds to confirm that they are pregnant. And most of the time, early pregnancy loss can be attributed to an infectious cause. So brucellosis is one of the highest ones there. Salmonellosis, Campylobacter, there are several things there that we will try to rule out. A genetic mismatch, sometimes that does happen. And there's embryo interference. So these are litter-bearing species, and there's only so much room in that uterus. And if there's not enough room to have that many placentas developing normally, then we're going to have some embryonic loss just because there's so many that are there. And that's something that does happen. If you see one resorption, but you see 6 or 8 healthy babies otherwise, probably not a big deal. If there's 3 babies and you see 2 resorption sites, that's certainly extremely concerning. And then the last thing, or the last 2 things that we're going to talk about is endometritis. And I put a question mark on there because we talk about it in horses all the time. We know it happens in dogs, but we don't have a lot of scientific evidence. But we're going to talk about what things we can do to try to determine if we have that going on. And then rare pathologies. So this is where we're kind of getting into the rainbow colored zebras. So cystic endometrial hyperplasia, these are cysts that are happen throughout the lifetime of the dog. The more open cycles that she has where she wasn't bred and she didn't carry, the more likely they are to have CEH. This is going to contribute to abnormal endometrial lining where those placentas are supposed to attach. And then fecundity loss due to age. So as we age, we know at 5, that's kind of the end of our fecundity. If you're trying to breed an older female, as long as she's in good health, that's probably fine. That being said, don't expect to get a litter of 12. You might only get a litter of 8, or you might get even less than that, just because that fecundity loss, because she's older, and other factors are going to play into that. So let's talk about endometritis a little bit more importantly. So vaginal cultures, and I know this is a soapbox, but a lot of dog owners request these, and canine male contracts are going to the way of stallion contracts, where they're requesting to have a negative culture prior to being bred to their dog. That being said, the problem is just the same as it is in mares. This is not always 100% the reason that things are happening. And the vagina has normal flora. So just culturing the vagina, the vestibule, or the cranial vagina is not going to always result in a negative culture because there's normal flora that's there. What we have to do is we need to make sure that we're identifying whether or not there's inflammation, because if it's normal flora and there's no inflammation, there's no problem, no need to worry about anything else. But if she's got inflammation going on and we're growing a pure culture in an appropriately obtained sample, and she has a history of subfertility or infertility, then we should be standing up, okay? The same rings true as if we happen to do a urinalysis via cystocentesis and we have an active, looks like we have a UTI and we culture that. That's something we need to be paying attention to. We're not going to do this routinely, but if we have a history of these things going on, then it's something that we're going to think about. The biggest thing that I want you to take away from this slide is prophylactic antibiotics are harmful. By giving antibiotics without a diagnosis, we are actually selecting for opportunistic and more virulent pathogens than what normally exists in the vagina. We are undoing that balance, and we're also giving those opportunistic pathogens the ability to create resistance. So just because your female missed once does not necessarily mean that we get to throw antibiotics at it. It means the next time around, we are going to be timing her very carefully. We're going to be following her very carefully, and we're going to do this in a stepwise fashion. Because again, just putting them in on antibiotics, especially if people are doing it for 3 or 4 weeks at a time, that's giving those bugs a lot of time to create resistance. And it would be terrible if she didn't really need it. And at some point in her lifetime, she really does need that antibiotic, but now we've got bacteria that's resistant in her body. So again, just be very careful. And so if we have questionable infertility or subfertility, intrauterine culture and cytology is a deal. This requires specialized equipment. The picture that's on here is a intrauterine catheter that has been passed through the cervix, and we are actually infusing fluid into the uterus. We kind of shake her up a little bit. We pull that fluid back out, and that's what we use for our culture and our cytology. I know what I got back was in that uterus. It wasn't in the vagina, it was in that uterus, and I can trust my cytology and my culture. And so here's the list of normal flora: Pasteurella, beta hemolytic strep, E. coli, mycoplasma, staph, proteus, pseudomonas. So there's a lot of things that can be present there that may or may not actually be causing a problem. So again, got to be really, really careful with what we're doing with these cultures. A cytology that has a lot of inflammation like this picture represents, it's going to be really, really important to make sure that we're distinguishing between something that's normal flora and not causing a problem versus something that may be causing an issue. And then how do we interpret them? Again, physical exam, complete reproductive history, including who was she bred to, were they proven, did they have a BSE? Because it may not be her, it might have been the other 50%. This is kind of like an investigation that we have to do. Guarded swab instrument, ideally, and if you see over here, these are kind of the different types of things that we can use, or endoscopic equipment for intrauterine sampling, and then making sure that you're doing a cytology with that culture or you're holding your culture until you do your cytology. If it's not inflammatory, then likely doesn't need to have a culture run. And then again, knowing what your normal flora is, because we don't want to treat normal flora. We want to treat what's causing a problem. And for that, we need to have evidence that it's causing a problem and that it's there in high numbers. So those are the two sides of the equation that we need to talk about. So timing, and then what's going on in the female and what's going on in the male. Now we're going to move into genetics. And again, this is something that I don't think a lot of people talk about. And so when we talk about our breeds and our breed standards, if we have genetic variability that is highly variable, then we're going to get very unpredictable phenotypes. So we're not going to know what the temperament's going to be like. We don't know if they're going to be big, they're going to be large, long-haired, short-haired. Like our predictability is extremely low. But as we move to more genetically undiverse, or we have a same population of genes available and alleles available to us, we have extremely predictable. And that's great. Except for at that point, we have a lot of genetic diversity that's been lost. And so we have to find a balance point between genetic diversity and uniformity so that we can maintain this. Because what people don't realize is that the first thing that goes when our genetic lines start getting a little too close and our genetic diversity is too low is we see a drop in our fertility. That is the very first sign that we see. It's not that we start having more problems with a very specific disease or type. It's that our fertility drops. So maybe we were having litters of 8 or 9, and now we're only having litters of 5 or 6. That should make you, if nothing else has changed, our BSEs are the same, females are fairly the same, that should be a big red flag. And so that uniformity is great, but at the same time, we have to have this balance between genetic diversity and uniformity in our breeds. And so diversity and genetic management it is very difficult, but something that we all can manage to do once we have an understanding of the terminology that we use. So we all talk about screening for the genetic diseases that we can. We're going to screen based on generational influence and not the individual phenotype. That's where we're trying to maintain genetic diversity, but having what we like as that uniform. There are a few exceptions to this, but most of the time, we're trying to select individuals based on that. The biggest thing is to realize that all breeding needs to be done on a tiered system. So think about this pyramid that's represented over here. Tier 1 is the commercial tier. So these are kind of your ho-hum, just lots of these individuals, may not necessarily be breeding stock in most people's mind, but they still do exist. And they're the basis of which most of our breeds have. Tier 2 is what's called your multiplier. And your multiplier is actually your strongest tier in your breeding program. They can breed up, they can breed down, and they're actually going to be the ones that produce the elite dogs. Elite dogs typically do not produce elite dogs. The top tier being your elite dogs, okay? And so again, the more tier 3 we breed to tier 3, that pyramid is going to go really quickly to a straight stick where it goes up and down. Whereas if we're only breeding tier 1 dogs, poor dogs to poor dogs, or ones that, have a high genetic variability, we don't get much predictability. Our pyramid kind of goes more to a flat road. And so again, breed your weak to your strong, make sure that you're getting your genetic phenotype that you want, but you're maintaining your diversity. And minimize poor environmental influences, because polygenetic traits are going to come with those environmental influences. And those are things that we can control. I can't control genes and I can't control recombination, but I can control environment. And then again, keep up with the latest up-to-date literature related to the condition or anything that's happening in your breed, because that's going to be important. But popular sire effect is a major problem. And with the use of artificial insemination, being able to ship genetics all over the world and do so in multiple formats, really the ideal situation is that less than 5% of any breed is sired by the same sire or closely related individuals in any given year. Because what ends up happening is we end up with a genetic bottleneck. And so now we have nobody that we can outcross to that is going to cause us some fertility issues. And this is something that has happened time and time again in multiple species. And so again, as a stud dog owner, even if you own a very valuable sire and very sought after sire, being very selective on how many times he is bred in any given time frame in his lifetime. And then if you get frozen semen stored on him, how that's used in the future is going to be extremely important. And the male side is a lot easier to control than the female side. A male can sire a lot more litters than a female could ever put on the ground. So again, less than 5% of any breed is sired by the same male in any given year is really, really important. Okay. So lastly, we're going to move into some of the endocrine. And I'm going to pretty much cover only one endocrine disease because it's the one that is touted the most. And fortunately, that's something that we have studied here at Virginia, Maryland extensively over the years. And I think we've made some headway. We just need to kind of get breeders to wrap their heads around some of the breeder lore that is historical versus what the evidence is showing scientifically. And that's hypothyroidism. And so hypothyroidism is 0.2 to 0.8 of the population are actually affected. But if you actually look at the literature, 84% of English setters, okay, and this is based on OFA records, and that was self-reported. So, you know, people that are actually saying that their dog was diagnosed with canine hypothyroidism are affected. Currently, there are 50 breeds recommended by the AKC and CHIC to have screening for thyroid disease. And there's two forms of it. There's lymphocytic thyroiditis and there's idiopathic follicular atrophy. And which one of those does it really matter? Not necessarily. But the thing is hypothyroidism is very difficult because this is a long, slow onset of disease. Most of the time, the dogs on average are going to be 7 years of age by the time that they're diagnosed with this disease. And they've contributed to the breeding pool at that point. And so it would be something that would be similar to PRA. So by the time that we have them diagnosed with the disease, they've already put puppies on the ground. And so we got to be really careful about this. And so diagnosis is really important. And so gold standard is going to be taking a blood sample, but there's multiple things that we can do with that blood sample. A total T4, which is something that your clinic can do without a problem, doesn't require being sent out. You can do that. But a total T4 is not specific enough, okay? It's not really that helpful. So the thing is that we need to realize that there's a difference between thyroid disease because there's something else going on in the body, which is, you know, called 6 thyroid syndrome. Okay, we've got something else that's going on in the body that's causing our thyroid antibody or our thyroid hormones to be eaten up versus a dog that's got thyroid disease that has low thyroid hormones because they're not producing enough. And so those two things we have to be careful about. And that's why these tests are really important. So a free T4 is going to be really important because that's evaluating the active forms that are circulating in the body, which is the most accurate if you're going to do a singular test. TSH combined with a total T4 or a free T4 is 98% specific for the disease. So if your dog has a high TSH and a low T4 or a low free T4, then certainly that can be diagnostic outside of having another disease process happening at the same time. So do not test these animals if they have a dermatologic issue going on. They just had a fever a week ago or 3 weeks ago. Make sure that they're happy and healthy when you test them. Now, sight hounds, there's always going to be an outlier. Sight hounds have lower circulating T4 and free T4 just as a breed. And so most of the time we're going to use what's called T3 on them and free T3. So just be aware if you have sight hounds, we test them a little bit differently. And then we kind of move into this thyroid autoantibodies. The funny thing about the thyroid antibodies is that 50% of hypothyroid dogs are going to be positive, but 50% of them are not going to have circulating anti-thyroid antibodies. But if you have a positive thyroid antibody that's reported out, but the dog is not having any signs of weight gain, hair loss issues, any of the clinical signs that go with the syndrome, that doesn't necessarily warrant in the diagnosis, and you have to retest them yearly. And so again, being very careful about what tests are being used and when we're doing it is going to be extremely important. And so What does this mean for reproduction? So a lot of people have implicated hypothyroidism in females for not cycling normally or not cycling at all, not being able to get pregnant, losing her litters, all of these types of things. And so I'm just going to scroll through some of the papers that have been done, and I have a chart, so don't think that I'm going to leave you hanging. So these are the papers that we know about. Okay, these are the ones that have been done. And so in a chart form, here are multiple of the papers, who they tested, what parameters were evaluated, and the conclusions. And the big thing is that you have to realize what happened to these animals, okay? So if you look at the top paper, the 2007 Paint Sierra paper, as well as the 2020 and the 2012 papers, those were all the same people together that did those papers. And it was the same group of animals. And every single one of those animals, we induced hypothyroidism by obliterating their thyroid with chemicals. They had no functioning thyroid whatsoever. In 2007, every single one of the hypothyroid dogs cycled, they got pregnant, they carried their little to term, and they had their puppies. What we found in that group was that the hypothyroid had smaller puppies and more periparturient mortality, but all of their puppies caught up in stature and size by 3 to 4 weeks postpartum. So again, that was really, really interesting. So then we took the same cohort of dogs and bred them another time after having been, again, obliterated their thyroid. They were hypothyroid, profoundly hypothyroid by the time they were bred the second time, and only half of the hypothyroid pregnant dogs got pregnant. So again, were we seeing some things there? Probably yes, but you need to realize that these dogs had no functioning thyroids whatsoever. The other studies that are on here, so if we're looking at the 2009 paper, the 2016 paper, and the 2023 paper, you need to realize that these were normal individuals that they were using that were implicated for infertility, not necessarily diagnosed with the disease or had the disease that we know of. And they were measuring these values during either breeding, pregnancy, or lactation, or a combination of all of those. And so it's interesting, the 2009 didn't see a difference between the groups and 204 dogs implicated for disease. In 2016, they saw T4 decreases up to a week prior to abortion, but the problem is why did they have the abortion? They didn't diagnose why that was happening. And so was it the endocrine disease that was causing the abortion, or was there something else going in their body? Because remember, I just told you that thyroid hormones are eaten up during disease states. So what caused the abortion? I don't think it was the thyroid being low. It was the fact that something else was going on. And then in 2023, which was in contrast to our 2020 paper, they said cycle-specific ranges may be necessary to be able to determine what's normal and what's not normal. But the problem is they only measured T4, free T4, and TSH 6 times between estrus, pregnancy, and lactation. And so those were spread out pretty far, and it was a little bit of a different ball game. And so again, this is what science is out there. Now, on the male side, males have been implicated with having poor semen quality, low sperm numbers, no libido, all of these types of things. And so again, here are the papers that are out there, and I've got it in a chart format. If you look at these, the papers from 1976, 1985, and 1985, all of these animals were genetically related. So thyroiditis having a link to orchitis or autoimmune disease, in these thyroids, all of these animals were genetically related. So was it really their thyroid, or was it their genetics that were causing these abnormalities that they were seeing? Then in 1999, they had 3 healthy controls and 6 hypothyroid dogs that were confirmed by stimulation tests. They did BSEs on them every 3 months for 2 years, looking at thyroid functions and BSE, and they did see a difference between libido or BSE parameters in the 2 groups. So that was pretty interesting. And then again, in 2009, they looked at 204 dogs implicated for the disease and their fertility status as males in the survey. They also looked at T4 and TSH levels, and they saw no difference between the groups. So for the male side, we really don't have any evidence that that hypothyroidism is affecting them at all. And so, oh my gosh, what does all this mean? It's so different than what I've been told. None of the prospective studies that have simulated a naturally occurring disease process, like none of them have simulated what people say is causing the disease. Tried and true reproductive manifestations required us to actually obliterate that thyroid before we saw any reproductive manifestations. So take home thoughts. Are the reproductive manifestations what we see due to the low circulating hormones? Because either we have something going on with our thyroid or we obliterated our thyroid, or is it a secondary thing that we're seeing related to the endocrine disruption with a resultant obesity and chronic inflammatory state? Because we know both of those things happen. Obesity causes a chronic inflammatory state. We also know it has implications for low fertility in multiple species. And so if anything, it's a weak association. But there was this really nice paper that came out just last year talking about body condition and fertility in dogs. And as overcondition happens and our dogs become more obese, our fertility goes down. So again, we kind of knew that, I think conceptually, but trying to blame the thyroid and putting them on thyroid supplementation, we're not actually treating a disease process. We may be altering their metabolism through swinging them hyperthyroid, taking some weight off of them, vamping up their metabolism, which is something we can do with diet and exercise and not putting them artificially on a drug that they don't need, because there is no scientific evidence out there to tell us that we really have that much of a difference between the girls, except for in animals that we literally just, they had no function in the thyroid whatsoever. Okay. And I should note that the females in that study that we did here, where we saw after long-term hypothyroidism, that only half the bitches got pregnant. When we supplemented, those girls went right back to getting pregnant, carrying to term, and having their litters without an issue. So again, really, really interesting research that came out of that. And so let's put this all together. Timing is the number one cause of infertility. And I put that in air quotes because, again, if we have not gotten semen into the female in appropriate numbers at the right time and of adequate quality, we're going to have a mess, or we're going to have lower numbers. Okay. Check fertility parameters on both the male and the female. Male should be done because it's easy. We can do it quite often. And we can actually look at their gametes. Sperm cells are easy to look at. Oocytes we can't look at and outside of in an artificial means. This needs to happen often and before every breeding. Genetics need to be evaluated every single time, every single pairing. You need to be thinking 3 to 4 generations ahead. And if you're starting to see a drop in your number of animals and it's not timing and it's not because of fertility parameters outside of knowing the other things that we discussed about, then look at your genetics. Please stop blaming the thyroid for your infertility problems. And please don't put your animals on supplementation. And please don't put your animals in antibiotics. We need to have very good evidence worked up. And if you're having issues, seek out a theurologist sooner rather than later. They're all over the country. They're all over the world. Most of us are very willing to work with you, consult with you and your veterinarian. If you can't get to where they are, then certainly this can be a two-way street, but do that. I'm going to put in a plug. There's this book that more for Dr. Spanenberg's part of it, that he does a very good job of going through genetics and how to maintain lines and diversities without having to compromise your phenotype. So again, this book is available and out there. Here are some references. And with that, I'll take any questions.
Awesome. Thank you so much for another amazing presentation. This was so great. We have time, I think, for a few questions. So first question from one of our community members is, why might a dog go into heat without ovulating?
So I'm assuming that this is something that has been documented, that she's not ovulating, somebody's following a progesterone. There is a phenomenon called split estrous cycles, and it does happen. It tends to happen a lot on the very first estrous cycle that the girl has. It's not a fertility issue. It's a management issue. And for some reason, and like I said, a lot of girls will do this their very first heat cycle. They will produce estrogen, but it will not hit a threshold high enough to stimulate ovulation through luteinizing hormone. And so they'll swell, they'll have serosanguinous discharge. They'll go through that part of their cycle, but then all of a sudden it just goes down and we never document ovulation. Most of the time, the girls within 1 to 2 months are going to come back into estrus. They will go through the entire process. They will go ahead and ovulate and have a fertile cycle. So again, split cycles are not a fertility issue. They're a management issue. So catching those girls, documenting what she's doing, and following your progesterones for ovulation are going to be extremely helpful.
Awesome. Okay, then this next question we have is someone wondering if a female can become infertile even though she may not have had normal litters previously and is still, oh, she may have had normal litters previously and is still regularly going into heat.
Regularly or irregularly? Just want to make sure I heard that right.
Regularly.
Okay, so again, we kind of talked about fecundacy. So the more times you've carried or not carried, or the older that you get, certainly there's going to be 50% of that equation is going to be on her. So making sure that we're in a good plane of nutrition, we watch how many back-to-back-to-back breedings that we're doing, because nutritionally they need to have time to recover. If she's a girl that's cycling every 4 months, you're not going to be able to breed her back to back as easily as if something that cycles every 8 months. There's more time for her body to recover at an 8 month cycle than a 4 month cycle. And then making sure that there's nothing else that was causing that infertility. You know, we want to blame one side or the other, but we need to check both sides, because it could have been the combination of the two, or it could have been one or the other, as opposed to pointing fingers. But it's hard to say without a workup, but as they age, I expect them to lose that fecundacy. And like I said, 5 years of age is a tried and true kind of cutoff. Very few animals beyond 5 years of age are having what I would consider, quote unquote, a normal large litter and having an easy time carrying and whelping.
Definitely. Okay, this next question is kind of a large question, but a good one, I think. Is fertility an inherited trait?
Absolutely. And so that very first slide that says choose for fertility, do not keep animals in your kennel that you have to do artificial means of insemination. If you are breeding them naturally, or you're doing side-by-side vaginal AIs and they won't get pregnant with either one of those, but they'll get pregnant with the TCI, don't keep those girls in your kennel. That is not conducive for life. Same thing with males. Do not keep males that are having infertility issues or subfertility issues outside of like a traumatic event or something like that. It's just not worth it to your breeding program, and it's not contributing any diversity that is necessary in that line.
I feel like that was a really good question. Thank you for answering
That was
that
a great
one.
question.
One more question is, when should one consider surgical AI? Is there like a certain point that you should start considering it?
Okay, so we know that transcervical insemination and surgical insemination have the same pregnancy rates and the same litter sizes, so they're considered equal. If we're doing it just to get the semen a little farther up into the uterus, then we should do a transcervical insemination rather than a surgical, because the surgical is highly invasive. There's a pretty significant recovery time from that. Plus, there really shouldn't be more than 3 abdominal procedures in the lifetime of an animal before we're starting to worry about adhesion formation and complications from those types of things. So if you're doing surgical, you're reducing the number of times that that animal can actually have a C-section if necessary in the future. The only time that we do surgical inseminations in our practice is if we see something that is abnormal and we actually on ultrasound and we want to get our hands on that animal. So for example, we had an animal that had a very long history of infertility. She had been bred to fertile dogs. We knew they were fertile based on puppies put on the ground and current BSEs. She had been bred with good timing. Like I said, with these fertile males, she was referred to us. We did an ultrasound on this animal, and she happened to have her ovaries were very closely associated, and her kidneys were very far back in her abdomen. So we suspected that she had an anatomic abnormality, but ultrasound can only tell us so much. And so we ended up doing a surgical a laparotomy on here, where we actually went in her abdomen, and sure enough, her uterus and her ovaries and her kidneys were all farther back in her abdomen than they normally are. Her uterus was abnormal, and so at that time we kind of had the discussion of whether or not this was going to be a fruitful endeavor or not. The decision was made to go ahead and breed her surgically, and she, lo and behold, did not get pregnant. But we knew that she didn't have a normal uterus at that time. And so again, really the only utility for surgical insemination for me is if there's something that we think is abnormal, and we want to go in the abdomen and we want to see and get our hands on that uterus and those ovaries to see what's going on.
Awesome. That is super interesting. Okay, I think we have time for one more question from our live audience. This is from Amy, who's wondering what test should we require of the bitch owner to ensure protection of our male?
That's a great question. So like I said, a lot of our male owners will at least require a negative brucellosis, and progesterone timing. You can't really request a culture because again, cultures, we're usually going to grow something, and how you interpret that is going to be very, very difficult. But certainly brucellosis and progesterone timing or some other format of LH timing is going to be fine. Some people even go as far as saying, I want the gold standard progesterone test. I don't want, an ELISA-based test that you can do in-house. So that just depends on you, and how much protection. But on the flip side of that, as a stud dog owner, you should be providing them BSEs that are recent within the last 4 to 6 weeks so that they can understand that you're doing your part to ensure that the semen that you're probably going to provide them is going to be adequate.
Amazing. Okay, I think that was our last question. Thank you again to everyone for joining us today and for asking such wonderful questions. Thank you, Dr. Cecere, for joining us for another amazing presentation. We love having you do these for us, so we are just so grateful for your time. I think everyone learns so much. And one thing I want to call out, the only question I am qualified to answer during these presentations is that it was recorded and it will be up on our Facebook page immediately after this. I saw a few questions in the chat about rewatching it because I know there was so much information, so many charts. I know a lot of people are going to be wanting to take a little bit of a closer look. So that is available to you as soon as this live ends. So again, thank you all for being here. If you're not yet a member of our community, you can apply to join at gooddog.com/join so you can stay up to date on all of our future webinars and exclusive events. And speaking of future webinars, I want to give a sneak peek of the next one we have coming up because we always have another one in the works. So next we will be joined by Dr. Andrea Hesser again on Wednesday, September 11th at 1 p.m. Eastern. And she's going to be presenting on the role of progesterone testing in canine pregnancy, part 1. So there's going to be another part following that later in September, which we're really excited for. And we're going to be learning how to use and interpret progesterone testing to aid the timing of breeding your female. So I think a really nice follow on to this discussion. So we're already looking forward to that. We're going to get that event up later today so everyone can RSVP and make sure that's on their calendars. But until then, thank you all again for being here, and we'll see you at our next webinar. Bye, everyone. Thank
Thank
you.
you.